I'm Dr. Natalia Novikova. I'm a gynecologist. I have practice in Cape Town and in Johannesburg, and my special interests in medicine are obviously gynecology, minimally invasive surgery, as well as a new field, cosmetic gynecology. Vaginoplasty is a procedure to tighten vaginal canal. It would be for women who need tightening of vagina, and those women would be sometimes after childbirth, after normal vaginal childbirth that was maybe traumatic, where there was a particular tear that wasn't repaired appropriately or didn't heal well. Or it could be that vagina was just too stretched during childbirth and did not return to its size prior to pregnancy, and women feel unsatisfied with their sexual life. Sometimes aging and loss of collagen leads to vaginal relaxation or laxity, and women seek for vaginal tightening because of those reasons. At times I see young women who haven't been pregnant, who are in their 20s, who already look to have a vaginal tightening, and mainly they come up with this idea because of dissatisfaction with their sexual function. They don't feel enough, they feel that vagina is too loose. One has to remember that vagina doesn't work on itself. It's got to be a partner that is part of the process as well. And sometimes it's just discordancy between the partner size and the vaginal size that leads women to look for surgical correction of their vaginal size. Vaginoplasty traditionally is a surgical procedure, so it would be something that is done in the operating room under general anesthetic, and it would require a couple of weeks recovery time. Quite often on internet you will find other types of vaginoplasties advertised, and I wouldn't call it vaginoplasty. It's non-invasive procedure for vaginal rejuvenation or vaginal tightening that are performed with a laser or radio frequency or other energy devices, and they would also lead to the tightening of vaginal skin. We also have Emzella chair, that is electromagnetic, highly focused energy device that provides about 11,000 Kegel exercises within one session, and it leads to great tonus of pelvic floor muscles, and as a result vaginal tightening. So there is surgical option for vaginoplasty, and then there is non-surgical vaginal tightening procedures or vaginal rejuvenation procedure that are performed with various energy devices. How would one choose which option to go for? Well, it would depend on the particular problem and the severity of the condition and the expectation. And I always tell my patient to imagine someone having a laser treatment on their face or a surgical facelift, and the difference that one would expect. So it's quite similar with a vaginal tightening procedure. You can have a laser procedure where we tighten your skin in the vagina, or you can have surgical procedure. So the surgical procedure will be definitely more suitable for women with more severe problems. Some women quite often start with non-invasive, non-surgical options, and if they don't achieve result that they want, they would move on to surgical vaginal repair. Surgical repair has more complication or chance of complications such as bleeding, infection, pain. One may end up with pain during intercourse after the surgery because vagina is too tight. Of course, it's not the aim, and we take all types of precautions to make sure that we give a woman the results that she's looking for and that she's got no pain and great sexual life afterwards. But of course, there is chance of complications, and there is certainly a downtime. We advised to have no sexual activity for 6 weeks after the operation, and no exercise for that period of time, and couple of weeks of work, and just taking it easy with no housework and no running around and no driving. On the other hand, non-surgical options have no downtime practically. With a laser, it's 3 days of no sexual activity. With other devices, there is no downtime at all, and the risk of complication is remote with non-surgical options. So surgical vaginal repair or vaginoplasty entails anesthesia, and what we do is we perform a diamond type of incision inside of the vaginal canal and outside skin, and we remove the excess skin and then tighten the muscles underneath the skin with sutures and close vaginal skin. So basically, by cutting out this amount of tissue, well, I've shown too big, but it will depend on a particular patient, and then putting the tissue together, we provide tightening to the vaginal canal. Quite often it also improves aesthetic look or appearance of vagina. So some women would do vaginoplasty not because they have any kind of functional problems or complaints, but just because they don't like the look. They potentially don't like the scarring after repair of previous episiotomy, or a tear during vaginal birth, or what we call gaping of vagina looking too open. Generally after childbirth, and actually there is no functional problems, but the appearance is not suitable for a particular woman and she wants to improve it, and in that case we would do the vaginoplasty. The pain level would depend on particular woman, and some women have no pain at all and say that they don't take any medications, and others have a lot of pain and they take painkillers for a couple of weeks. And generally pain level would depend on many things. It would depend on the pain tolerance, also previous procedure. I find that if someone had unsatisfying experience before or very painful experience with their pelvic organs in the past, they're most likely to have more pain after the operation. And it would depend also on the extent of the procedure, so a bigger procedure would end up with more pain. Constipation is a common problem at the procedure, and generally if we can avoid constipation, there will be less pain. The most common procedure in my practice that I do simultaneously with vaginoplasty would be a labioplasty or reduction of labia minora or labia majora skin. So labioplasty is a surgical procedure that is also performed in the operating room, but generally under local anesthesia, so you do not need to go to sleep for it. It's a day procedure. We give you tablets to relax you and numbing cream to take away discomfort when I inject local anesthetic when I perform this procedure. This procedure is requested by women of all ages, younger women, older women, and generally women come to ask for labioplasty because they don't like appearance of their labia minora and they're too long. They may be uncomfortable during horse riding or cycling or running. They may not like the appearance in a swimsuit or sportswear. At times, sadly, they may be very self-conscious because of the appearance of their labia minora, because of the comments by their partners, and at times by the comments by their kids or little girls, daughters, who see the mom's labia and they think it looks horrific, and then women get the idea that, okay, it is horrific, I need to fix it. Interestingly, in some cultures, a long labia minora is fashionable, and there is a pulling of labia minora that is practiced, for example, in Mozambique to make them longer. So not everywhere in the world women are aiming to have Barbie look or kind of almost no labia minora. Of course, pornographic content has probably increased requests for labioplasty, because there is a particular look that people are aiming for, and that's what they see in the pornographic movies, and that's what they think is normal, and then they start believing that what they have is abnormal. But in actual fact, all shapes and sizes are normal, just as all shapes of sizes of noses and eyes and boobs are normal. However, it doesn't stop people going and fixing them into whatever other shape they want. So labioplasty procedure is pretty safe. We only remove the skin. The chance of long-term negative effects from this procedure is remote. 95% of women report improved sexual experience after labioplasty because generally they feel more self-confident, and sometimes there is just less tissue that is on the way during sexual intercourse, so there's no interruption and no unfolding of labia, and that helps women. In terms of pain threshold for the procedure, look, during procedure you have no pain because we inject local anesthetic, so the pain only is there, burning or discomfort when I inject, and that lasts for about half a minute to a minute. Once you inject it, you have no pain. The procedure is about an hour. Afterwards, you will not have pain for about 8 hours because I inject local anesthetic that stays in the wound for quite significant period of time. Post-procedure, I prescribe various painkillers, and some people report taking 1 to 2 tablets and feeling fine, and other people call for another prescription because this wasn't enough. So it would depend on a particular person, and also the amount of tissue removed, and maybe a few other things, and pain threshold. I must say that younger girls have more pain generally, but I think it's just a mental thing. People who are very anxious about the procedure and the outcome are generally going to have more pain, and people who are quite calm and not particularly bothered with the procedure, I generally have hardly any pain and quite good results, surprisingly. After the procedure, one of the greatest things that one can do is use lots of ice in the area continuously for the first few days. It helps with pain and swelling and bleeding, and it allows healing to happen quicker. And usually within a week, most patients have no pain and can go back to normal, except of having sexual intercourse and like cycling, horse riding, which we don't allow for 6 weeks. I've mentioned that women of all ages request this procedure, and quite often I hear from my patients that my labia have not been like this before, like it's a new thing, and I find it quite surprising, but I do believe them. And what happens is that because we lose collagen, everything sags. And though labia didn't really grow in your 40s or 50s, definitely not in 60s, it's quite possible that because of the loss of collagen and loss of fat tissue, they look longer and they feel longer. So I understand it's a valid reason to want to sort it out, and quite often it causes a lot of irritation because of the thinning of the skin, and that removing of that excess skin actually is quite helpful for those patients.